UT Southwestern. I'm excited to come to you today with special guest, Dr. Elizabeth Polk. Dr. Polk is an internal medicine specialist here at UT Southwestern. She is also the program director for the Palliative Care Fellowship Program and associate program director for the Internal Medicine Residency Program. As usual, don't forget to like and share this conversation and leave any comments you have in the stream below. We'll get to as many of them as we can, but please do remember that this chat should not replace a doctor's appointment. If you have really specific medical questions, you need to make an appointment with either your physician or request an appointment here at UT Southwestern. We're happy to see you. But we're going to go ahead and get started now. Dr. Polk, thank you for joining us.
Well, thank you. It's a pleasure to be here.
It's an interesting topic. So for you, I guess kind of to get the conversation going, are there concerns, health concerns that are specific to the LGBTQ community?
Well, there are, although theoretically there shouldn't be, because, lesbians and gay men are men and women just like the rest of the community. So theoretically the health concerns shouldn't really be any different. Most of what we see, though, is as a consequence of the stigma that's been attached to being homosexual or transgender or bisexual in our community. As you know, up until 1973, it was a jailable offense to be gay in the United States, and so you can imagine that there's a lot of baggage that goes with that. And so what that means is that gay people are less likely to seek health care. They're likely to not, even when they do seek health care, not convey to the healthcare provider their sexual orientation. And then they're also likely to have a lot of internalized stigma that means that they may not take as good care of themselves. So there are a lot of health concerns that come out of that. So there are actually quite a lot of health disparities.
So what should someone's primary care physician know about their sexual orientation?
It's funny. I tell people that part of the reason you go to medical school is to learn to feel comfortable talking to people about things that are taboo to talk about at a cocktail party. And one of those is that you do need to be able to take a sexual history from someone. You need to be able to ask about things that put people at risk for adverse health outcomes. And you need to understand what puts people at risk for infection and for cancer. And sexual activity puts you at risk for infection and for cancer. And so the primary physician does need to know what are your risk factors for that. So they need to know who are you having sex with and how are you protecting yourself when you're doing it. Those are awkward things to bring up, but it needs to be done. And it's funny, I think we assume a lot about people based on how they look, but I have been shocked at how many times my assumptions about people have been incorrect. So you really do have to ask.
Gotcha. Well, one of the questions that came in ahead of the chat was from a colleague here, and her question was, is there anything a parent of a child who identifies as LGBTQ should know before kind of that child enters the dating scene?
So number one is the best indicator of how healthy, both mentally and physically, an LGBT teenager is going to be is their parents' level of support, regardless of anything else. And I'm not saying that the parent needs to agree with the lifestyle. The parent doesn't have to say, I agree that it's okay to be gay. I'm not saying that, but the parent does need to say, I love you, I support you, you be who you are. And so that's one of the best indicators, because again, that helps reduce the stigma. It tells the child it's okay for you to be who you are, and you are worth taking care of. And children tend to take far fewer risks with their own health. And then, I think that conversations about safe sex are uncomfortable regardless of the gender. And if you are a heterosexual parent trying to advise an LGBT teen, you may not know what to tell that child, but you need to find out. There are a lot of great resources here in Dallas.
That's going to be my next question. Yep. Where can they get help?
And on the web. And I would say number one, is the Resource Center. That's the name of it. You can Google it. It's actually quite close to here. It's right up the road on Inwood. And they have incredible resources for LGBT youth. And I would say that's the first place to start. They have a lot of both online and print resources for parents and for teens.
Okay, that sounds great. So what resources are available, you mentioned, for that to help somebody who's maybe looking for an LGBT-friendly physician? I don't see that a lot listed on websites. You know, I'm LGBTQ friendly.
Yeah.
So how would you do that?
So the best place to look is for the HRC, the Human Rights Commission. It has a health equality index, and they have a listing of all of the agencies that are certified by them, and they have a relative score for each of the facilities. So anybody that's interested can look that up. It's called abbreviated the HEI. And they will indicate to you how LGBT friendly that facility is, and that way you can find a facility that's a good fit for you.
Oh, that's great, thank you. And we're going to be sharing links to the resources that our good doctor here is recommending throughout the chat. So if you miss one, don't feel like you have to write it down. We're going to provide those for you. So, you know, one of the things that's been in the news a lot is PrEP. Can you tell us a little bit about what that is and who it's designed for?
So PrEP is really, I think, a miraculous breakthrough in treatment of HIV. And what it is it's pre-exposure prophylaxis. So it's a medication that people take, just like you would take malaria prophylaxis if you were going to a high malaria risk area. This is for people who are at high risk of contracting HIV, and it's a medication that they take every day before exposure. So you take it every day. You still take the normal precautions that you would take to prevent transmission of the disease. But if you take this medication daily, it reduces the risk of transmission by about 73%. So it is a fairly miraculous medication, and I think in the scientific community, there's agreement that this really could be what ends the HIV epidemic. The major barrier at this point is that the company that makes the medication is charging quite a lot of money for it. And I don't want to be overly political about it, but I would say that it's going to go off patent in 2020, and hopefully generic companies are going to start getting in the market and making the drug, and that hopefully by maybe 2022, there will be enough companies in the market that it'll be a lot less expensive. You know, I think, you know, the people that are predominantly affected by HIV right now, to be honest, are they're gay communities, predominantly in the South, and they're predominantly communities of color. So I think there is not as much political pressure to drive down the price on this drug as there should be. And so I would encourage anybody who feels strongly that this is a social justice issue, which I do, to let people know, you know, Congress has the legal right to let the company know that they must drop the price of the drug. Something very similar was done with ciprofloxacin back when we were worried about anthrax. And they collaborated with the company to find a price point at which the company could still make a profit, and the government could afford to buy the drug and stockpile it so that people would be safe. And what I think from a public health perspective would be the right thing is for us to negotiate with the company and find a price point where we could get enough of this drug for everybody that needs it to get it. Right now, I mean, well less than a third of the people in the country who need this drug are getting it because of the price point. So we could end the AIDS epidemic today if the government were willing to fund it.
Good to know. All right. Well, we're starting to get a lot of questions in, so I'm going to go on to these. So our first question is from Christy, and it's, what are common workplace issues for LGBTQ individuals, and how can employers be more inclusive or mindful of this community?
So I think the first thing is for employers to make it known that they are open and welcoming. I think a lot of LGBT employees are going to assume that the workplace is not welcoming until they hear otherwise. So the first thing is for the employer to make it known. The second would be that I think the group that experiences the most discrimination would be transgender individuals. I think that they have a lot of internalized stigma. They expect very much that they're going to be discriminated against, and the reality is that they are. Many transgender individuals are going to lose their job. There's not a great deal of employment protection for them, and so I think the burden is on the employer to make it clear that that's something that they support. The other thing I would say is that there's a lot of great online training. There's one thing in particular called Safe Zone Training.
I've heard of that.
That employers could subscribe to, and not necessarily, I wouldn't recommend mandating anything because people don't respond well to that, but offer. If you have a business, you can put up a Safe Zone sign showing that everyone in your business has been trained in this. And I think that's an incredibly powerful signal to your employees that that's something that you value.
Yeah, absolutely. Good question, Christy. Thanks for asking. Here's one from Forrest, and he has a two-part question. Do you think there are disparities in the LGBTQ healthcare? And second part, in 2019, why are we experiencing these?
I think it gets back to the stigma question. Clearly there are disparities in the healthcare. Most of it is, again, in the LGBT community, sort of anticipating that they're going to be treated differentially. Again, the group that is discriminated against the most is transgender individuals. There are a lot of providers still who feel uncomfortable caring for transgender individuals. I didn't get any training on this in medical school at all. I mean, it was not mentioned once. I did not get any training on it in residency. Anything that I know about this is something that I have taught myself. So we're not taught about it. People feel uncomfortable about it. Different parts of the country have different levels of comfort. So people are scared of things that they think are different. So I think people expect to be treated differently, and they are treated differently. But I also think that even with the best of intentions, there is implicit bias. And I'll tell you just very briefly, you know, I wear a rainbow flag on my badge, and I had not always done that, and I started doing it, and I realized that a lot of my patients that I had not asked specifically a sexual history, I do mostly end-of-life care, so I didn't always ask about it. Several of my patients that I had not asked about it said, "Oh, I really like your pin." And then one of my patients in particular, who had always brought her sister to her appointments, she goes, "You know, she's not really my sister."
Oh.
And I was like, "Really?"
Just because you put your
But
pin
but
on.
it was because I had been wearing my pin. So I think, you know, there's so much of this that we underestimate because of just implicit bias and not looking.
So that being said, we have a question here from Amy, and it's interesting, and this may be outside of your area of expertise, but her question is, why do you think there's less LGBTQ individuals working in healthcare?
I think a lot of it gets back to sense of self-worth as teenagers. One of the things that happens, you know, people realize that most people form their sexual identity, sexual orientation around the age of 10. And it's when they sort of get their first crush. And when that happens and it is a same-sex person, or if you're transgender and you have that clear sense of yourself as being transgender, what happens is that you realize very clearly that you are different from what is established as the norm. And so you start to have a sense of yourself as different and, depending on your family of origin, wrong and broken. And when that starts to happen, unless you're in a very supportive environment, a lot of people start to sort of withdraw. And so the risk of alcoholism, the risk of drug use, the risk of, you know, when kids are not accepted by their families, a lot of kids are runaways, a lot of kids drop out of school. I mean, the risk of homelessness in teenagers, I mean, the overrepresentation of the community and the homeless is huge. The overrepresentation of LGBT teenagers and suicides is enormous, and so we lose a lot of people. And so I think you have to have a very supportive environment to get through college, to get through medical school. And so if you don't have that supportive family and that sense of self-worth, it's going to be hard. So I think we lose a lot of people, and I think that may be part of it. The other thing is, I think there are a lot more people in healthcare than is realized, and people may not feel comfortable being out.
Gotcha. Okay. Good question, Amy. Thanks for joining our discussion. I know we're doing some things here at UT Southwestern. Can you talk a little bit about what we're doing to kind of increase the entire community's cultural competency about LGBTQ?
Sure. So, the first thing is, this is our first year. We're having a very big Pride Month celebration, so I'm really excited about that. And at the end of the month, we're having our Pride event, and we're having a speaker, which will be Dr. Roberto Dela Cruz, who's the CMO at Parkland, and a longtime friend of mine. So I'm very excited that he's going to be speaking, and he is going to be speaking much more in depth about LGBTQ health disparities, sort of the root of those, and then much more about how we can help try and mitigate health disparities. So I'm very excited about that. We do submit a report every year through the Health Equality Index. And so we're looking forward to our feedback on that and how we can continue to improve both as a workplace and as a provider. We do have our business related group, which is a group of employees here, trying to sort of collaborate among ourselves and identify any areas here at the university where we can continue to improve. And then also really pin down areas of patient experience that we can improve. For me, a particular area of interest is a website, because I want people to be able to look at our website and see, see that we're sort of a family caring for family, because there's really good evidence that people do best. Everyone does best when they have the option to have concordant physicians, right? So a lot of people are most comfortable having, many lesbians are most comfortable having a lesbian physician. And so people need to know that they have those options. We need to increase our workforce. We need to make it clear that people have that as an option. They may not choose it, and that's their right, but they should know that that's an option. So those are things that we're working on.
Sounds exciting. Well, we've got a couple questions here. Sandy, we will put a link to the event page so you know how you can get there. Here's one from Heather that she says, I've read that lesbians are less likely to get preventative services for cancer. Why is that, and are there other health issues or trends prevalent among lesbians?
So that is absolutely true. I think many lesbians are under the misconception that if they are not having sex with men, they are not at high risk for cancer, and so that they don't need pap smears, and that's not true. They need to go ahead and have pap smears and see the gynecologist. So a lot of lesbians do not see the gynecologist, and they need to go ahead and do that. I'm not sure why they're not getting mammograms, but they need to go do that as well. The other risk for lesbians is obesity and overweight, and I think part of it goes back to the self-care and stigma. I think part of it too is that they are less concerned about conformity to male ideal body shape, and less concerned about male gaze. That's just my suspicion, but those are the two biggest things.
Okay, good to know. Great question, Heather. Thanks for joining. We do only have a couple minutes left, so if you have some last minute questions, please get them in now. So here's a separate one. This one's from Christy, and the question is kind of a big picture, and that's how have we made progress in LGBTQ healthcare in the past decade, and where do you see things going in the future?
So I think the biggest progress has been sort of a consequence of overall civil rights and overall visibility of the community. I think the more people feel comfortable with self-expression, the more they feel comfortable sort of disclosing to healthcare providers and seeking healthcare. So I think that's good. there has been tremendous tremendous progress in HIV. And clearly the advent of PrEP and the availability of PrEP is really miraculous. And if we could get that funded and use that, that would be fantastic. I think also the visibility of transgender actors and actresses in Hollywood has been fantastic. Like actresses like Laverne Cox,
awesome.
Particularly transgender actors and actresses of color. That has been wonderful, and I think has been really phenomenal in terms of just visibility and acceptance. So I think that's been really great. I think the art is really trending in the right direction. I think the next generation, coming up, I have grade school age children for whom being gay or transgender is really a non-issue. They have transgender friends, and for them that's not anything that they consider out of the norm. And so I think if we can eliminate stigma as a major player, we really should see most of the health issues go by the wayside, because that's the problem, is the stigma. So if we can eliminate that, I think most of the rest will go away.
Amazing. So last question. So you've spoken kind of extensively about the most challenging times are generally during teenage, early 20s. What are some things that those of us who are maybe past that point can do to help those individuals?
I think just we need to live as a community. I think we need to all keep an eye on each other. Anything that you can do if you have a colleague with a child that is going through that, to help them, to normalize it, to let them know, this is, human sexuality is a spectrum. Even if you have a daughter that is not lesbian but is just a tomboy, that's fine. We have there's a very wide range of normal. So anything that I think anyone can do to just increase acceptance of everyone being themselves, and their gender expression and gender positivity, regardless of what it is, I think is a very positive thing. And I think really checking yourself on your own biases is important. I think everyone should do the Safe Zone training. There's a lot of free training available online. There's a lot of training through HRC available online. Anything you can do to eliminate your own blind spots, I think is really helpful.
All right. Well, unfortunately, that is all the time we have today. But I want to thank everybody for all the great questions you submitted and for participating. This is definitely an important topic. Many of the links that Dr. Pruitt, excuse me, that's one of the questions. Many of the links that we referenced are in the comments field, so just you can go back. We will also be sharing this video on YouTube later today, so if you have friends and loved ones who aren't on Facebook, please encourage them to go look at it there. But I want to thank you so much for your time. It's been wonderful to have you. And
it's been a pleasure.
It's been a great conversation.